Now, I'm not a fan at all of videos filmed in bed. I usually find them pretty lazy whenever anyone's talking about any points that they're doing a video on. But there's no other option for me to make this particular video than to do it laying down in bed. And I can't sit up to do the video because it won't demonstrate the point I'm about to immediately make. So a couple of months ago, I got diagnosed with severe sleep apnea. So what that means is that machine that's there is called a CPAP, and I have to sleep with that every night, right? And that means I have to strap this thing, this CPAP thing, over. I have to put this over my nose and then strap that around my head, okay? And I've got to sleep with that every night. When I first got told that, I thought, fucking hell, that's a bit annoying. But at the same time, I had gone into hospital because I'd noticed myself waking up in my sleep and sort of gasping for breath. And so basically what happened was in the middle of the night, I would suddenly feel my heart beating out my chest very fast, and it would be a sudden like that. But like I would instantly sit up in bed, my heart would be going very fast, and I thought I was going to have a stroke or a heart attack. And this was very different to when I had anxiety before, and I used to have like panic attacks in the night and that kind of thing. My breathing felt restricted. And so I went to the doctors. They said, let's have a sleep test. And I had a sleep test. They did a sort of an oxygen thing that goes up your nose, and then they put a thing on your finger, and then they measure it, right? And when they measured that, and the reason I'm also lying down, because I want to demonstrate a load of sort of fear-related scenarios that I used to have in the past that I can't do in any other way but to lay on this pillow and demonstrate this. So basically, what then happened was I realized that with sleep apnea, so you get two different types. You get obstructive sleep apnea and central sleep apnea. And I got the form that the doctor gives you, the hospital gives you, and tells you what kind of sleep apnea you have. And I have obstructive and central sleep apnea. So it's called complex sleep apnea or something like that, right? And I can't remember. I had like 40 awakenings of stopping breathing. And so they said, okay, that's severe sleep apnea. So I had to, so they said, right, you're going to have to start using this CPAP machine. And at first I wasn't too fond on the idea, because you think of sleep as just being able to go to sleep anywhere. You feel like, oh, you can be with your partner and go to sleep, whatever, right? These thoughts come into your head. And I thought, I've got to sleep on this bloody machine now for the rest of my life. But also AI is advancing. I imagine these things will disappear. They used to be as big as a fax machine. Now they're not, right? And basically what happens, I realized, okay, I've got to sleep with this thing. And then I stopped waking up, gasping for air. And sleep felt more refreshing, and I genuinely felt better. And then once I got used to it after a week, I didn't give a shit about using the CPAP anymore. At first, I thought I'll use the mouth guard thing that they suggest. But then after a while, I thought to myself, do you know what? I went to the dentist, a very nice dentist that I've known for a while, and I said, look, I've got some sleep apnea. He said, what type? And I said, severe. He said, you can't have the mouth guard. That's mainly for mild to moderate. And so I thought, okay, I'll have to use CPAP. So a guy came around, installed the CPAP at my house. I've been using it ever since. Absolutely fine. Sleep, no problem. Just glad to not have anything more serious when I was in the hospital, when I was having those problems with my sleep, because I was feeling lethargic, I was in intermittent sleep, all these kinds of things, and waking up with this horrible gasping for breath thing where my heart would go off like a machine gun. So yeah, I got diagnosed with severe sleep apnea. That basically means that something in my throat closes when I'm asleep. Obstructive central sleep apnea, and then central, as in the signals in the brain, signal something in the throat that stops that, so makes the throat close up, right? And so it was a combination. And the CPAP keeps the airway pouring with air, so you've got air pouring into your nose that keeps that airway pressure high, so that it stops that situation from happening. Now, when I used to have severe chronic OCD, and I was in the midst of suffering with this for many, many years, what used to happen was I had so many things relating to where I'm laying right now in bed. The first thing was this. When I had this really bad neck injury, very, very bad neck injury, where I had a bulging disc in my neck, but it was so bad I was having at my worst to have physio 2 to 3 times a week. To get out of bed, I had to lift my hair like this and pull my head up because of the weight of my head. And I was in just chronic pain all night, every day, all through the day, waking up in and out of sleep because of pain. And then I couldn't lay on my side because my shoulders, I'm not particularly, it's sort of a narrow frame, and so the gap between my neck to my shoulder and my head would always drop over, so I'd have to pile the pillows more. But then I was suffering from acid reflux as well. So when you're suffering from acid reflux, what happens is you've got acid in the back of your throat, and so then I was scared that I was going to choke on that, or it was going to go into my lungs, and I was going to get like a kind of pneumonia that occurs when acid goes or food goes into your lungs. So I was constantly propping my head up with pillows like that, right? And then I was constantly trying to lay on my side, lay on my other side, all these kinds of things, and changing position, doing that, and then scared that the acid would go in my lungs, and then when I did move the other way, then my neck would get bad, and I'd wake up with just like completely locked necks, or when your neck is all sort of spasmed. And so I was pretty down about all that situation. Plus, I used to wake up every morning with the highest level of anxiety, and just like I used to sort of take my phone and take pictures of myself just to check how dark the circles were under my eyes. Like, how bad was my sleep? Was I damaging my brain and going to give myself Alzheimer's because of unrefreshing sleep? I was scared of that. Then I was checking my teeth, right? And I was looking and I was thinking, right, look, see those front ones are a little bit ground down, they're a bit flatter. So I was thinking, I'm grinding my teeth, they're going to get ground all the way down, I'm going to damage all my teeth. That means that I've got some anxiety in my sleep that's subconscious, that I'm not aware of, that's in my jaws somewhere, that's making this grinding happening. And then I used to wake up and sleepwalk. Then I used to talk in my sleep, all these different things, right? Now, I haven't had any of that stuff at all, like, for a very long time. Like, when I lay in bed with my partner, I said to her, do you notice me talk in my sleep, ever get up? She says, no, sometimes I've noticed you like scratch yourself in your sleep, but not that bad. But that's actually true. I do still get that sometimes, that one, where I wake up and sometimes I've got like a deep cut on myself, and I look and I think, fuck, how's that happened? And I've done it in my sleep, and it tends to be across my back, just over here. And I get that one rarely, very rare. But when it does happen, the scratches, I think, fuck, did I get in a fight or something? Or did I cut myself on something? But it's that. So that one I get sometimes. Realistically, nothing like the years of chronic severe OCD. Years of chronic severe OCD, I was basically having that thing where you wake up and you see that there's sleep paralysis. It looks like there's like an old witch or something at the end of your bed. Which I imagine people get, whoever shares a bed with mom in. But you wake up and you look at the end of your bed, and it looks like there's like it's called like the old hag or something. It looks like there's a shadow of an old woman at the end of your bed, and you look at that and you think, oh my God, what the hell's that that there? And then you go to move, and your body won't move; it's completely paralyzed. And so you think, fuck, like maybe I've been injured or whatever, and then you think you're never going to get out of that state, and then in a few moments later you wake up from that. Now look, if you have any of these situations, I was having these all the time, right? So what I did is I used to think, if I sleep on this side, or if I sleep on that side, or if I breathe through my mouth or my nose or whatever, these things will go. No, they had nothing to do with any of those things at all, right? Those things were totally irrelevant. It was me trying to avoid it, to try and escape it. And I had that sleep paralysis one. I had that for ages. I had the that one would come and go, but for a very long time. I had the teeth grinding for a long time. I went to the dentist. They were like, "Oh, you've probably got TMJ." I had I'm trying to think now what other ones I had. Sleepwalking. Waking up, having sleepwalked somewhere, just like looking out the window. That used to freak me the fuck out. Like, I used to wake up standing, looking out my window, just standing there. Like, so you wake up and you're like, how the fuck did I get here? That was very, very scary. Then I had all kinds of acid reflux where I woke up and I thought I was choking on acid reflux where I woke up and I thought like I was burning my throat and damaging it, going to give myself Barrett's esophagus, going to give myself esophageal cancer. So I was particularly worried about that. So I used to position my bed like right now here, there's what I'm sleeping on is like two pillows, right? But positioned this so I was on like 4 or 5 pillows, so that my head was completely up that, then my whole back. Then I used to put pillows under the bed, right, under the feet of the bed, so that the whole bed was propped up, so that I wouldn't get acid reflux, so it would burn me, and I'd become compulsive about that. Then what I used to do is I would check like a picture frame like this above the bed, and I would constantly check if the thing was bolted in properly, because I thought if it wasn't, then it would fall on my head. Now, if it was in my own house, what I would also do is I would check that on someone else's bed in a spare room, in case that I had done the screws wrong and then it fell on their head and killed them. So I would check that constantly. What other things did I have? Sleeping with like an eye mask, because I thought if any light comes in the room, I'll get insomnia. Then I had insomnia for on and off for years, sleeping 2 to 3 hours a night, walking around feeling horrendous, constantly taking selfies to check my eyes to see how refreshing the sleep was, thinking I was damaging myself, constantly on my phone all night because I was so scared of not sleeping, on Reddit all day, all through the night, trying to see if anyone had it as bad as me. Insomnia was like one of my worst experiences with OCD. When I had very, very bad insomnia, that was really not a good experience at all. And then, like, recently getting this sleep apnea machine. If you've got this thing on your nose, right, you've got this pipe, this tube, right? So when you roll over, you've got this is also in your bed. So you're positioning yourself so that pipe is not on your body. Then you're thinking like, oh, if I was with chronic insomnia again, I'd be thinking like, oh my God, I'm never going to sleep now. I've got this CPAP. Oh my God, having that tube on me is going to make things so uncomfortable. And like all variations of that is what occurs as well. So you have those things, and I think what happens is you just become If I had sleep apnea, I was on that CPAP, I was at the peak of my insomnia, I had the acid reflux, I had the bad neck. You'd feel like everything was closing in from all sides, because like so much of the time it does feel like things are closing in from all sides. When I was getting one thing after another, I was getting the acid reflux, I was getting the bulging disc in my back, I was getting all that's not even to not include all the stuff that comes with OCD. Like with OCD, you get all the stuff that's like you get things that are all the fears, like harming, killing someone in your dreams, torturing someone in your dreams. Oh my God, I like that. That means I really want to do it. Oh my God, it was a family member. I'm a monster. Like, of course, your dreams are completely random, but they feel so real. And then you can't tell them apart, and then you become convinced about all of that. So I had all that as well, but like, I can't tell you. Oh, the night sweats, waking up in bed, having to change all the sheets, having to change all my, like if I was wearing t-shirt, boxer shorts, having to change that. If I wore pajamas and it was like cold, they'd be drenched right through. And like, then I wouldn't have another pajamas, and I'd be angry and be like, fucking hell, if only this hadn't happened. This isn't normal. Oh my God, what happens if a partner sees this? All variations of this stuff over and over and over again. And then pillows. That was the main reason I was making this video lying down. So obviously here, these pillows are sort of medium, right, in terms of sort of depth and sort of squishiness. But then I'd get to hotels where it'd be very thin, and I'd be like, right, I can't sleep here at all. Or the bed's too hard, I can't sleep here at all. It's going to make my insomnia worse. I might as well not go away. Oh, I've got to make sure I go to a hotel with exactly the right pillows. And then I'd occasionally, all right, first world problems here, 100%, I understand that. But like I'd go to a hotel where they'd have like a selection of pillows or something, and I'd be, oh my God, that's perfect. Now I've got just the right pillow. I can enjoy this hotel. Or you go and stay with someone. They're like, look, I haven't got a guest room, but you've got to sleep on the couch. And then I'd think, fuck, I can't sleep on this couch. But this is so weird, because for years, I would have slept on people. I slept on people's couches at house parties, things like that. I never thought once of it. But it's only when all that insomnia and the OCD caught up, it got in on all that stuff. And it sounds so stupid and trivial, but like, when you're in a position where you're convinced that the bed is stopping you from sleeping, then you've only slept 1 hour and you're on a holiday where you're having to do excursions in the day with family, friends, whatever. You start getting into a position where you start thinking, this is my life for the rest forever, right? And I try and make this page really real. Even like making videos in bed like this, there's no shame about it. I could make a video anywhere or do anything. I don't have any shame feelings. But like, I wouldn't be the first to be making videos in bed. I like to make videos at the desk or whatever, do them reasonably professionally like that. I always find these kind of like a lot of this TikTok generation stuff of selfies everywhere and videos in bed and videos in the bath. Like it doesn't need to be like that. But this content needs to cover these points because they're related to exactly these things. And I think that the most important way we change OCD recovery is just being really real and getting into the realities of these things. And it's very difficult in today's era because of so many things, like so just so many ways to avoid things, and this sort of fake world we live in of filters and thousands of selfies, and like all the selfies I ever took in my life were all just for OCD. My phone was just full of selfies because of OCD. Because I would literally just wake up and do this. How's my eyes? How are my teeth? Right? Does my neck look like it's got worse? Yeah? And these kinds of things, right? They weren't self-image. They were completely to do with, is my body decaying because of OCD? Is my body getting damaged because of OCD? And that's what I was focused on, right? And for women, it was different. For women, it might be like, oh my God, are they losing their hair? Right? I couldn't care if I'm losing my hair. I'm losing my hair. But like for women, it's different. Like if you're losing a lot of hair with anxiety and you wake up in the morning and your hair's coming out and you go in the shower and the hair falls down, it goes in the shower, you start to then see like really what the OCD is doing. Like often when it's in your head, it's not so bad, but then when you see it doing real damage, you're like, oh my God, my health, this is so terrible. This is the worst thing ever. How's this happen? I can understand that completely. Like when I used to wake up with such bad, unrefreshing sleep all the time, I used to look and think, fucking hell, why do my eyes look so bad in the morning? Like I used to wake up feeling refreshed, like I'd been in a warm bath and like gone to a specialist hospital where they just repair all the body, and you wake up nice and fresh. And then it was just waking up like I was being hit by a train of death, and it felt like that, right? And I just used to look at myself and think, God, look how pale you are. Look how tired you look. You're not going to make it past 40, and I'm nearly 40, and that's what it was like for years, right? And it was sort of additionally made bad because of like seeing the dentist, the doctor, who'd be like, yes, Robert, you are grinding your teeth. Does your jaw come forward? Maybe we should make you a mouth guard. All these things, I thought, fucking hell, I don't want all these things, mouth guard stuff. And like, even when I got this CPAP the other day, I'm in a very different position now with acceptance. Of course, I didn't want it at first. But if I spoke to the team and everyone around me the same days when I was having when I was in hospital for the sleep test. I wasn't angry, like screaming. I was frustrated. I wasn't anxious, scared. I was just, yeah, this is not fun, right? This is really not fun, right? Because I'll tell you why it wasn't fun. Because the way I found out about this sleep apnea is I was waking up in the middle of the night with this breathing thing, right? Which was also giving me palpitations. And I was thinking, have I got some subconscious anxiety or something going on? So I just walked down to the kind of urgent care at the hospital, and they were like, okay, look, we'll do an ECG. And then they did the ECG, and then they were like, there's an irregularity here, we need to keep you for 2 days. And they kind of just lock you in there when they do that. You don't really get much choice in the matter. And then they ran this sleep test because I insisted on it, and then they found this, and like, since finding that, it changed everything. But at first, when you're having all that stuff, right, you've got to be in hospital, you've got to be there for a couple of days. I was like, fuck this. And I didn't know what was happening. You see, my dad's got narcolepsy. And I was thinking, I hope I don't get narcolepsy, like falling asleep all through the day a lot, So you're going to naturally get frustrated at things. But I was still doing calls and I was in the WhatsApp groups. I was frustrated, yeah. I was a bit concerned. Right. And at the worst, I was like, I could be really not doing with this. Right. And pretty frustrated at that level. Right. But if that was me during the years of chronic severe OCD, trust me, that would not be the case at all. In those years, what would have been happening was I would have 100% been thinking to myself, my whole world's falling apart, my body, my nervous system's fucked, everything's going wrong, how much more can I get that goes bad? And I'd have been super inwards focused on all of that, which was definitely not the case. And I think that, when I look at the things as you go through life, you think of lots of things like, it's good that those things in some ways didn't happen when I was at the peak of my OCD because I already had enough on my plate. The acid reflux was very bad because the acid reflux got so bad, I developed dysphagia, which meant I couldn't swallow food. Food would get stuck, and then food would get stuck in the morning, especially like bread, rice, whatever. And it was that was pretty uncomfortable. Like I thought I was going to choke to death. I had to go to a centre gastroenterology centre. But then I had to have an endoscopy. Then they wanted to put sort of balloons down my esophagus to expand it. I luckily got around that and didn't need that. And I got better with protein pump inhibitors, Nexium and so on, omeprazole. I took that for 7 or 8 years. And a lot of that was psychosomatic towards the end years, because I was convinced that the years that I had that I was trying to prevent ever getting acid in my stomach, in my throat, because I thought it would burn so badly and I'd end up with dysphagia again and so on. So I just took it for ages, but it was me being scared. Like if I was scared of acid reflux right now, I'd get acid reflux probably, because the nerves all round there get sensitized and then it kicks in. And that's what I realized. Now I eat spicy food. I have red wine before bed. I'm going to go and have a coffee. I'm in a hotel, so I'll go downstairs, I have a coffee at the bar. I've already had a coffee today. That's no problem at all to have multiple coffees before bed. Sometimes I have coffee half an hour before bed. I went to Starbucks the other night, late night Starbucks. Had a coffee about half an hour before bed, a large cappuccino, zero effect. When I had insomnia, there's no way I would do those things. Going and having a coffee right before I was going to sleep, that would have been like, I'd be laying there thinking, oh, I've completely fucked my sleep cycle, circadian rhythm, especially with jet lag and flights. And I have to travel often a lot, and like often take flights that go through the night. I have to change different time zones and so on. And irrelevant now. Like I think, okay, circadian rhythm's a bit off, have to adapt to it. But before it was like, no, you've permanently damaged your sleep cycle in your brain and something's gone wrong because other things have gone wrong for you before in your nervous system and all that kind of stuff. And like I started this video, I'd have killed for a video like this during any of those times, because I would have seen exactly what was going wrong. And I'm not in that position today, so I give that back to the community in the form of these videos to help people to realize they're not alone with these kinds of things. And yeah, and that's the reality of it. Yeah, you know, you're not alone in these kinds of things. I've had thousands of anxiety and physical anxiety symptoms, and I know what they're like. And like, I get into bed now, I don't think anything about it. I put that CPAP on, I go to sleep, I don't care. But when I had all those things for years, going to sleep felt like a torturous cycle where I was just constantly reviewing. How do I feel? How am I going to be? What's going to be the symptom tonight? Am I going to die in my sleep? Then there was the fear of sleeping and losing consciousness and dying, having a panic attack in my sleep, having a heart attack, a stroke, all those things. And, you know, it was very difficult times. You know, when you think you're going to have a stroke in your sleep, constantly measuring blood pressure, avoiding blood pressure for years, fear that it would be too high, lots of blood pressure related fears and related to health, you know, it becomes a slippery subject, and you a slippery thing in your mind, and you do so much stuff to avoid it. And so, yeah, that's why I've come on here to explain that, and just to realize that, you know, all those things can be psychosomatic. Like all the neck pain I was zoomed in on, like, oh my God, if my head's raised now for the acid reflux, my neck's going to get worse. Then my neck felt worse. And so those things go like that. That's what they do, you know. And yeah, that's oh no, then I had this other one I completely forgotten about, the sleepwalking. I used to pile up chairs against the door because I was scared that I'd sleepwalk and then like go and fall down the stairs and die, or go and kill someone in my sleep. That was my fear. So like anywhere I stayed, I did that. And then I was scared I was going to jump off the balcony of a high room hotel, so I didn't want to book high room hotels. And then I'd have to check all the windows were locked and sealed. And look, right now I'm in a high room hotel, and that the window's right at the end of the bed here, the door onto a balcony, and I haven't even checked those or checked the locks on them. And I don't do anything with the door, and I just take the risk completely, and it is nothing. I haven't even thought of taking the risk. I just haven't even thought about it. It's just so irrelevant to me right now. So there you go. That is why I'm in bed today. Well, not all day, but in bed this evening filming this, and I thought you would find that helpful.